Hi, my name is Jay McCallum, and I'm here with my business partner, Amy Flory, who is wielding the camera. And we wanted to post a follow-up video to a blog that we posted a couple of years ago about the serratus anterior. The serratus anterior is one of several muscles that control position of the shoulder blade. It's located underneath the shoulder blade and wraps forward onto the ribs. And along with some of the muscles above the shoulder, its job is really to aim the shoulder up. And so the point of the blog was that in some patients that have persistent pain over the top of the shoulder, which is such a common presentation, one of the contributing factors can be loss of strength or function of the serratus anterior, which leads to more load through the top of the shoulder as they're reaching, and particularly with folks who experience pain here with use of the arms. And so I'm not going to go through the assessment for that, but it's something we look for as we're seeing patients with that presentation. And I do want to talk to you about a couple of the exercises that we often prescribe to treat it. So the simplest exercise is to take advantage of the fact that the serratus anterior, in addition to rotating the arm up, also propels the arm forward. And to start with an exercise with a patient lying down. And this is a classic serratus anterior exercise where I'm propelling my arm up and coming back down and doing this movement pattern to really activate that muscle. The problem is that this muscle is quite powerful, and often it's difficult to really challenge it in this position. So as soon as we can, we like to move on to an exercise using body weight, which might look like this, where I'm pressing up and then dropping back down and pressing up to use that muscle. The problem with both of those is, of course, that it is using the muscle to propel the arm forward, and we would like to improve its ability to rotate the arm up. So where we'd like to progress to over time is to move towards two exercises in standing that really activate this muscle. One is an uppercut movement. As I bring my arm around, it's relatively high load for that muscle and kind of hard to shrug with. So this motion can be a very nice training pattern for that serratus anterior. And the other one is what's sometimes called the Statue of Liberty or the saber charge. Reaching kind of pattern like this, really making the arm long and really driving that upward rotation. So that's just a couple of thoughts on the serratus anterior as a contributor to pain over the top of the shoulder blade. Obviously, there's many potential causes for persistent pain over the top of the shoulder blade, and that's just one of them. But we wanted to give you a sense of what we look for when we evaluate those patients. I hope you enjoyed this video. We'll be posting these every week or two, so I will hopefully be talking to you again soon, or we'll take turns and have Amy talk at you next time. Thank you again for watching.